Welcome to the Futurist Public Intellectual. Corey Briskin and Nicholas Maggipinto sued the city of New York last month because they allege that the city discriminates against gay male couples who want to use in vitro fertilization, or IVF, to have children. They argue that since straight couples and lesbian couples qualify under the city's healthcare plan for up to 3 rounds of IVF treatments, gay male couples should be treated equally and given coverage too. This is one of the moments when it's really important to have public intellectuals who provide alternative voices regarding social issues. While it's easy for the media to simply pander to the drama caused by people like Briskin and Maggipinto, someone needs to ask the deeper questions. But let me start with an unfortunate assessment. These gay men are entitled 30-something millennials who aren't willing to accept limits in their lives. Just like a reasonable blind person doesn't spend years demanding to get eye replacement surgery, even if such a thing existed, a reasonable gay man would recognize that the lack of a uterus is simply a fact in one's life. Just like Helen Keller learned to flourish despite her disabilities, it is appropriate for gay men to flourish in a way that is cognizant of their natural limitations. In other words, if they would accept that being gay men means that they don't naturally have access to a uterus, living a life without a child or adopting a child are both satisfying ways to be married gay men. This is exactly the kind of problem that one would expect to ensue after legalizing gay marriage. BGLQT people are living in a world that puts heteronormativity on a pedestal instead of being allowed to forge an existence that honors the natural differences that BGLQT people have. Briskin and Maggipinto are gay men who want to live like straight married people, but gay men will never be like straight married couples. They are not lesser than straight people, but they are also not the same. Their lawsuit is indicative of their unwillingness to accept their difference. To be fair, in a world that assumes that everyone deserves a shot at IVF, Briskin and Maggipinto certainly shouldn't be treated differently. In short, I agree with their argument within the confines of the current city healthcare plan. However, I think it's important to ask whether IVF should be subsidized by any healthcare plan at all, particularly one that is being paid for with taxpayer money. If there should be a lawsuit at all, it's one that would ban IVF from being subsidized by any healthcare plan. It's madness to think that the same liberals who want to flood the country with illegal migrants are the same people who want to give subsidized IVF to everyone. If we're going to add millions of impoverished people to our population, shouldn't we use taxpayer money to help these migrants instead of using up to $90,000 per couple for IVF treatments that may or may not work? If 100 couples use all 3 IVF treatments that they're entitled to under the city's healthcare plan, $9 million would have to be spent on infertile couples in a city that is drowning in illegal migrants. Sometimes the most compassionate thing that one can do for humanity is to sacrifice one's unnecessary desires. If you're infertile or gay and you want a child, adopt an illegal migrant orphan. You'd be helping 2 social issues at once. Thank you for listening to the Futurist Public Intellectual.